You feel it building, that deep, unmistakable pressure that tells you it is finally time. You make your way to the bathroom, you sit down, and then nothing happens. Or worse, a small, hard fragment passes, and you are left with that frustrating, nagging sensation that something is still trapped in there, still sitting right at the very exit. If that description sounds painfully familiar, I want you to know you are not imagining any of it. The stool truly is stuck, not high up in your colon where you might expect, but low down in the rectum itself. And that, as I will explain, is a completely different problem from ordinary constipation, which is precisely the reason most laxatives keep failing you over and over again. In the next few minutes, I am going to show you exactly why this happens to so many people. I will reveal the 1 teaspoon remedy that can get things moving in as little as 30 minutes, and then I will show you how to stop it from ever coming back. Here is the single most important point that almost nobody ever explains clearly. There are 2 completely different kinds of constipation, and they each demand 2 completely different solutions. The first kind happens high up in your system. The stool moves far too slowly through the colon, it dries out along the long journey, and it can take several days just to reach the exit. That slow, high-up problem is exactly what most over-the-counter laxatives are designed to treat. The second kind, however, is what you are actually dealing with right now. The stool already made the journey down. It successfully reached the rectum, but once it arrived there, it simply stopped. It refuses to come out. This condition is called outlet constipation, or dyschezia, and it is astonishingly common, especially once people pass the age of 50. So why does it get stuck right there at the finish line after coming all that way? I want you to picture the rectum as a holding chamber. It is the last few inches of the journey before the exit. Wrapped snugly around the bottom of it is a muscle called the puborectalis, which acts very much like a sling. When you are standing upright or sitting on a modern toilet, that muscular sling pulls the rectum into a sharp kink, almost exactly like a garden hose with a tight bend pinched into it. That kink is genuinely useful. It is what keeps you continent throughout the entire day so you do not have accidents. But when it is finally time to go, that very muscle has to relax and release. If it does not relax, the stool travels down, hits that stubborn bend, and stops cold. On top of all of that, when stool is forced to sit inside the rectum for too long, the body continuously pulls water back out of it. So the longer the stool waits, the harder and the drier it becomes. Eventually, you are left with a firm, dense plug sitting right at the exit that simply will not move on its own, no matter how hard you try. The usual culprits behind all of this are fairly predictable. A diet low in fiber, not drinking enough water, ignoring the urge to go when life suddenly gets busy, certain medications including opioids, iron supplements, and some common blood pressure drugs, pelvic floor muscles that have quietly forgotten how to relax properly, and the simple, unavoidable fact that every one of these problems becomes more frequent as we age. And here is the cruel irony. The harder you push, the worse the entire situation becomes. Straining does not open that kink at all. Straining actually tightens it further, and it sets you up for painful hemorrhoids, fissures, and even prolapse down the road. So let us get straight to what actually works. When the stool is already stuck inside the rectum, you do not need something that travels slowly through your entire digestive tract for 2 whole days. You need something that pulls water directly into the stool that is already sitting down there right now. The remedy is 1 single teaspoon of milk of magnesia, that is magnesium hydroxide, taken on a completely empty stomach with a full glass of water. Here is precisely why this works when so many other things fail you. Magnesium hydroxide is what we call an osmotic agent. In plain everyday English, that simply means it pulls water out of the surrounding tissues and draws it into the stool. So that hard, dry plug sitting stubbornly in your rectum begins to soften from the inside out. Within 30 minutes to a few hours, most people feel the urge return naturally. And this time, things actually move. 1 teaspoon is about 5 milliliters. That is genuinely all you need. You do not need a tablespoon, you do not need any more than that. More is absolutely not better in this situation. Too much magnesium can cause loose, watery stools, painful cramping, and even electrolyte problems, especially if you find yourself taking it frequently. For occasional use, once in a while when you are truly and genuinely stuck, 1 teaspoon is the perfect sweet spot. Now I want to share a few genuinely important cautions with you. Please do not use magnesium hydroxide if you have kidney disease. Your kidneys are the organs responsible for clearing magnesium out of your body, and if they are not working well, that magnesium can build up to dangerous, even life-threatening levels. Be equally careful if you have certain heart conditions or if you take any medications that affect your electrolytes. And if you take prescription medications of any kind, always check first with your own physician. Magnesium can interfere with the absorption of some drugs, so the timing of when you take it genuinely matters. Now, if you would prefer something even more local and even faster acting, there is a second excellent option, and that is a glycerin suppository. You gently insert it into the rectum, and it goes straight to work, right where the actual problem is. It draws water into the stool, and it gently stimulates the rectal wall to contract on its own. Most people feel real results within 15 to 30 minutes. For stool that is literally right there at the exit, this is very often the fastest and gentlest solution that exists, and the best part is it is available at any pharmacy without a prescription. What I genuinely want you to avoid, especially as any kind of regular habit, are the harsh stimulant laxatives. These are the ones based on senna or bisacodyl. They work by chemically irritating the bowel into contracting forcefully. They can cause severe cramping, sudden urgency, and over time your bowel can actually become dependent on them to move at all, which is a terrible cycle to fall into. For an occasional stuck stool, osmotic magnesium or a simple glycerin suppository is always the smarter, gentler, and safer choice. 1 teaspoon, empty stomach, full glass of water. That is your rescue plan. But here is something most people completely miss. You can take the absolute perfect remedy and still sit on that toilet for 20 long minutes with nothing whatsoever happening, simply because your body is in entirely the wrong position. Remember that muscle I mentioned earlier, the puborectalis sling that kinks the rectum closed to keep you continent? Well, when you sit fully upright on a modern toilet, that kink stays partly in place. You are essentially asking the stool to push its way through a tight bend, so it is truly no wonder at all that it keeps getting stuck. The fix takes about 60 seconds to set up, and honestly, it changes absolutely everything. Get yourself a small step stool, somewhere between 6 and 9 inches high. Place it directly in front of your toilet and rest both feet flat upon it. Now your knees are positioned higher than your hips. Lean forward slightly and rest your elbows gently on your knees. This single, simple change, knees above hips and your body leaning forward, straightens out the angle inside your rectum. The kink unfolds and the path finally opens up. Now the second piece, which truly matters just as much as the first. Relax your belly outward. Do not suck it in. Do not clench it tight. Simply let it soften and gently push it forward. Then breathe. Take a slow inhale through your nose, letting your belly expand outward, followed by a long, slow exhale through your mouth. As you exhale, simply let go completely. You are not pushing at all. You are releasing. This is the exact opposite of what most of us were taught growing up. We were taught to hold our breath and bear down hard. That actually tightens the pelvic floor and clamps the exit shut. Belly breathing instead tells those very muscles to release and open. Try this combination. Feet up, lean forward, belly out, slow exhale, and you will very often feel stool that has been stuck for hours simply slide out on its own. No straining, no forcing, just the mechanics done correctly. Now let us move from rescue all the way to prevention, because the real goal here is not to keep reaching for milk of magnesia every single week. The true goal is to make absolutely sure the stool never gets that hard in the first place. There are three specific foods that accomplish this remarkably well. Each one has real, genuine research standing behind it. Each one is cheap and easy to find anywhere. And when you use all three of them together, most people stop having stuck stool episodes altogether. The first is kiwi fruit. 2 green kiwis eaten at dinner. That is the correct dose. Studies have clearly shown that 2 kiwis a day improves stool frequency, softens stool consistency, and reduces straining within just a few short weeks. Kiwi contains a unique combination of soluble fiber, water-binding compounds, and a natural enzyme called actinidin that gently supports healthy digestion. Eat them with the skin still on if you can tolerate the texture, because that is where most of the valuable fiber actually lives. If you cannot manage the skin, simply scoop out the soft green flesh with a spoon. The second is ground flax seed. 1 to 2 tablespoons each day, stirred into water, yogurt, oatmeal, or a smoothie. The absolute key word here is ground. Whole flax seeds pass right through you without doing very much of anything at all. Ground flax seed is completely different. It provides soluble fiber that absorbs water inside your gut and forms a soft, gel-like mass. That gentle mass keeps the stool hydrated the entire way down to the rectum, so it never gets the chance to dry out into a hard plug. Start with just 1 tablespoon. Drink a full glass of water along with it. Then work your way up gradually from there. The third is prunes. 5 to 6 prunes, or about half a cup of prune juice, in the evening. Prunes are nature's gentlest laxative, and there is a genuine reason for that reputation. They contain sorbitol, a natural sugar that acts as a mild osmotic agent, pulling water into the stool exactly the way magnesium does, but in a slower, food-based, gentler way. They also contain fiber and beneficial polyphenols that support healthy bowel function. Research has actually shown prunes to be more effective than psyllium fiber supplements for mild constipation. Kiwi at dinner, ground flax seed in the morning, a few prunes in the evening. Simple, cheap, and quietly powerful. Here is where I have to gently correct 2 of the most common mistakes I see, and these are the very reasons that a lot of well-meaning people accidentally make their constipation considerably worse. Mistake number 1 is adding more fiber without adding more water alongside it. This one is genuinely enormous. Fiber works by absorbing water and forming a soft, bulky mass that moves easily through the bowel. But if you flood your system with fiber yet fail to give it enough fluid, the exact opposite happens. That fiber turns into something far closer to concrete. It becomes a denser, harder, drier mass, and it gets stuck in the rectum in precisely the way we have been talking about. So if you start eating more flaxseed, more bran, and more vegetables, you absolutely must drink more water right alongside it. This is not optional. A practical target for most adults is around 25 to 30 grams of fiber a day, paired with 6 to 8 cups of water. Adjust upward if you are larger, more active, or living in a hot climate. Mistake number 2 is jumping in far too quickly. People hear that fiber is good for them and they triple their intake literally overnight. The unfortunate result is bloating, gas, cramping, and sometimes worse constipation than they started with in the first place. Add fiber slowly and patiently. 5 extra grams per week is plenty for your body. Your gut genuinely needs time to adjust to the change. And one more thing, perhaps the most important of all, honor the urge. When your body tells you that it is time to go, then go. The rectum has a built-in reflex. When it fills up, it signals your brain. But if you ignore that signal again and again, because you are in a meeting, because you are driving, because it feels inconvenient, that reflex slowly starts to fade away. Eventually, the rectum becomes less and less sensitive. The stool sits there longer, it dries out, and it gets stuck. So listen to your body the very first time it speaks to you. Now, before we move on, I want to share something with you that completely changed the way I personally think about fiber and digestion. Because here is a strange truth most people have genuinely never heard before. There is a small group of researchers who have actually shown that for some people, eating less fiber, almost none at all, combined with one specific ingredient, can empty the bowels nearly twice as fast as the high-fiber approach we have all been taught for decades. I know exactly how strange that sounds. It goes against nearly everything we just discussed, but it is genuinely backed by science. And it traces all the way back to an 8,000-year-old ingredient, what some people are now calling an underwater gut superfood, one that has been used by over 3 billion people all around the world. Just one single pinch of it before your next meal is enough to soften the buildup that can accumulate inside the intestines and support far more efficient digestion within just a matter of days. No restrictive diets, no expensive probiotics, and no medications whatsoever. If you have struggled with stuck stool, bloating, or that heavy, sluggish, weighed-down feeling for months or even years, you genuinely owe it to yourself to see how this actually works. I have put together a short presentation that walks through the entire technique step by step. To watch it right now, simply point your phone's camera at the QR code on your screen. If you happen to be watching from a computer, there is also a link pinned in the comments below this video that will take you to the very same place. Take just a few minutes to watch it. It may very well be the missing piece you have been searching for all along. Now, before we wrap everything up, I have to be completely straight and honest with you about something genuinely important. Most stuck stool episodes are mechanical and relatively harmless. They respond very well to everything we have talked about so far today. But the body also sends out clear warning signals when something far more serious is going on. And those signals deserve your full attention, never your silence. Please see a physician promptly if you notice any of the following. Blood in the stool, especially dark blood, or blood that is mixed in throughout rather than just sitting on the surface. A small streak from straining is one thing, but anything more than that genuinely deserves a proper evaluation. Unexplained weight loss occurring alongside changes in your bowel habits. A sudden change in the shape of your stool, particularly stools that have become pencil thin and stayed that way. Constipation that starts very suddenly with no clear cause, especially if you are over the age of 45. Severe abdominal pain, vomiting, or a complete inability to pass gas. These particular symptoms can signal a true obstruction, and that is a same-day medical emergency. And finally, repeated episodes of fecal impaction, where the stool becomes so completely stuck that you cannot pass it at all, even with all the remedies we have discussed today. None of this is meant to frighten you in any way. It is genuinely the very opposite. Knowing the warning signs is real empowerment. So let us pull every single piece of this together now. Stool stuck in the rectum is truly its own distinct problem, and it genuinely needs its own distinct solution. Regular laxatives that act higher up in the colon very often miss the mark entirely, which is exactly why so many people feel completely convinced that nothing ever helps them. When you are stuck right now, in this moment, the rescue is simple and clear. 1 teaspoon of milk of magnesia on an empty stomach with a full glass of water, or a glycerin suppository for something even faster and more local. Then, sit properly. Feet up on a small step stool, knees positioned above your hips. Lean forward, keep your belly soft and relaxed, and breathe out slowly. Let go instead of pushing. And to keep it from ever coming back again, remember the foods. 2 kiwis at dinner, a tablespoon of ground flaxseed in the morning, a handful of prunes in the evening, plenty of water throughout the day, fiber always added slowly and patiently, and the very moment your body tells you that it is time, you go without delay. Your body is genuinely not fighting against you. It is simply asking to be heard and understood. Listen to it the very first time, and it will rarely ever have to ask you twice again.